Good afternoon, ladies and gentlemen. Good afternoon. Welcome to the Kenya Vision Lunch. My name is Adrian. I'm from Trademark Hotel. We will be providing soup, and then we have chicken option and vegetarian option and the desserts. Because of time, we want to rush through the whole process. Uh, yes, we have the food section ready, and we'll be here to serve you. Karibuni sana.
Check, check, check. Give me some sound. Check, check one. Hello, check one. Hello, checking mic. Hello. Check, check one. Checking mic one. Hello. Checking mic one. Thank you.
Health opportunities video. Sneak health opportunities. E. So I need to download this.
Good afternoon. Good afternoon, our distinguished guests. Let me bring the room to order. If you can lend me your ears for a few minutes. We are now starting the session. It's a working lunch, so I hope you're all served up. Now it's time to start the official program. My name is Daniela Munene. I'll be your host for this session. And I'm really pleased to welcome you to this side session of the AHBS conference. This side session is looking at investment opportunities in healthcare in Kenya. It is a special Kenya side session. And I wish to introduce our moderator for this session. She is the first deputy governor at Kenya Red Cross Society. She's also a board member at Kenya Medical Practitioners and Dentists Council. She's also the immediate outgoing president of Kenya Medical Association. And she is Dr. Jacqueline Kitulu. Karibu sana, Dr. Kitulu. Please introduce the session to us and introduce the speakers.
All right, good afternoon, everyone. Good afternoon. Great. I thought I was talking to myself, but I can see also talking to your plate, so I'm glad everyone is well fed. So welcome to this Opportunities for Health Investment in Kenya, and this is being hosted by Vision 2030. So Kenya's Vision 2030 aims to transform Kenya into a newly industrializing middle-income country, providing Kenyans a high quality of life, including quality health services and products by 2030. And 2030 is just around the corner. At the point when it was started, it seemed ages away, but we are just a few more years to there. So Kenya's private health sector is valued at about 2 billion shillings in 2010. And the national health expenditure has been growing exponentially, 3.9%, 4.6%, and 16% year on year between 2015 and 2018, fueled by increased spending powers of the growing middle class, heightened awareness and demand for health services, and availability of a qualified health workforce. So massive opportunity. So government health spending as a proportion of total government expenditure stood at 6.2% in 2019-2020 against the Abuja Declaration of 15%. With the attainment of lower middle income status in 2014, Kenya faces deprioritization in allocation of donor funding, which has been a significant source of funding in the health sector. To accelerate the journey to self-reliance, there is an opportunity for private sector to take up a large share of healthcare expenditure. And this can be done by deploying innovative health products and services which leverage on the expanding coverage of health insurance and serve a rising proportion of people who can afford less subsidized healthcare. The annual private sector health expenditure in Kenya is expected to rise to $3.1 billion by 2025. I hope you're hearing those numbers. Opportunity, opportunity. This is poised to decongest government service delivery points, leaving room for the most vulnerable to access subsidized care and fast-track the country's move towards universal health coverage. So as an industrialized nation and universal health coverage, as industrialized nation and UHC, these are two of the four main pillars of the country's Big Four agenda. And currently, in terms of health products and technologies, the sector is largely imports, which are driven with 70% by value of finished products and 100% of raw materials imported. This, of course, increases the cost of finished products to the Kenyan population at a time when the country aims to increase access to quality, affordable health products and services. So import dependence also leaves the country vulnerable to supply chain interruptions, such as those we saw at the start of the COVID pandemic in 2020. So in terms of health service delivery, Kenya's healthcare professionals are well trained, as evidenced by global demand for our doctors, nurses, and even other health cadres. There is therefore an opportunity to position Kenya as a hotspot of medical tourism and as a regional pharmaceutical and health products manufacturing hub. So this session brings together government and private sector to demonstrate the gains made in local production of health products and technologies, as well as showcase the existing health service delivery capacity with a view to positioning Kenya as an investment hub for health. Experts shall lead discussions on emerging innovations, financing models, investment opportunities, and the optimal enabling infrastructural and policy environment that will accelerate the country's health sector journey to self-reliance. So to start us off, we have two keynote speakers. As you can see from the marking around us, Vision 2030. Yeah. So we have Vision 2030 as our sponsor. So our first keynote speaker and whom I'll be inviting to speak will be Mr. Ismail Maruf. He's the Director, Economic and Macro, Kenya Vision 2030. Karibu, Mr. Ismail.
Distinguished participants and guests, all protocols observed. Good afternoon. Let me say hamjamboni. Wageni wetu, karibuni Kenya. It's my pleasure, we as the Kenya Vision 2030, to sponsor this special session today and participate as keynote speaker under the Symposium of African Health Business Symposium, the 7th, I think this is the 7th, and start off a discussion around opportunities for investment in the Kenyan health sector, bringing on board the important players of the economy, the private sector institutions. And in so doing, I'll be telling our story as a country, Kenya, to make you feel closer home and understand where we came from and how far we have done the journey. I hope you have had the opportunity to go through this small booklet. Have you, please? If not, let me know. We will provide you so that once you go back in the evening, you will have an opportunity to read through. Next slide, please. The Kenya Vision 2030 is a country long-term development blueprint launched in the year 2008 with the aim or objective of steering the country to achieve a middle income, a newly industrializing middle income country, providing high quality of life for all its citizens in a clean and secure environment. The vision aims to transform Kenya and create a globally competitive and prosperous country with a high quality of life by the year 2030. Next, please. Yes. And in creating a globally competitive country, the vision has been built around 3 key pillars and a very strong foundation.
I'm Maria, and I am the product manager and marketing manager for Women's Health portfolio of products with GE Healthcare, focusing mainly on breast care and osteoporosis. So, I
a competitive country by 2030
These disparities
that
in our
will
continent,
attract
we see it every.
investment.
When it comes to women's health, one of the
Okay, yes. Our vision as a country is pegged on three main pillars, an economic pillar, a social pillar, and a political pillar, supported by a very strong foundation of enablers and a good macroeconomic environment for business. We have all, I think we have all been to Dubai, or at least some of us have been to Dubai, isn't it? And we love Dubai for many reasons. Part of the reasons why we love Dubai is the infrastructure in that country. The infrastructure that has been put in place in Dubai has made it an international hub for businesses. Our vision aims to transform our country to be competitive globally to attract investments of that nature. A globally competitive and a prosperous nation providing the quality of life for its citizens requires healthy citizens or healthy people. And our economic pillar, the country aims to maintain a sustained economic growth of 10% per annum until the year 2030. What that means is the country has to attract very strong manufacturing sector that will stimulate job creation, foreign direct investments, and also bring in technology exchange. Under the social pillar, our social pillar aims to attain a just and cohesive society enjoying equitable social development in a clean and a secure environment. Under the social pillar, the country aims to build a strong foundation for its citizens to enjoy good health, quality, affordable, and accessible health,
Egypt,
clean and a secure water, affordable housing for everyone. And in doing so, the political environment determines who and where someone can live and do an investment. Therefore, the political part of the vision entails to achieve an issue-based, people-centered, result-oriented, and accountable democratic political system. We as a government, in looking at the social pillar, we seek to build a cohesive society enjoying equitable development, social development. Health is one of the main sectors. opportunities available within the sectors of interest at both national and the county government systems. The vision conducts studies for investment opportunities in order to raise and better the enforcement standards in the sector, because this has been a concern to key investors, the established businesses who have always had the competition from counterfeit products. We envisage to enforce quality standards in distribution, diagnostics, and pharmaceutical products, and create a public good ground for digital health investments. Under the digital health investments, which is available, I think opportunities available at both national and also the devolved level of government, we help the investors digitalize, come up with
enable and de-risk private sector decision-making, investing, e.g. granular database and subnational disease data. In the process of engagements,
and actually even with a focus on the health sector and the area of healthcare workers and even the issues of training. I could see all those working in the HRH area really nodding and feeling at home with that area. So I think I'll move on straight in the interest of time to our next keynote speaker. So the keynote speaker is, of course, from the Ministry of Health, Ms. Susan Mochache, who is ably represented by Dr. Zainab Buru. She's the head of Health System Strengthening, Ministry of Health, Kenya. Dr. Zainab, karibu.
Thank you very much, Dr. Kitulu, for that introduction. Allow me to deliver the keynote address on behalf of Madam PS, Ministry of Health, Ms. Susan Mochache. I will read her speech as presented. Distinguished ladies and gentlemen, allow me to thank upfront the organizers of the symposium and specifically organizers of this event, the Kenya Vision 2030. We are grateful for you bringing us together so that we can be able to provide this deliberation. Allow me to discuss how we can expand the role of the private sector in women empowerment through reproductive, maternal, neonatal, child, and adolescent health. I shall expound on national and regional strategies, look at various barriers and challenges that women face, and also conclude by sharing nuggets of possible priority areas for new and enhanced partnerships, as well as a list of a few success stories we have witnessed that will exalt us to move with speed and embrace the future of resilient health systems. Distinguished ladies and gentlemen, while concerted effort by health sector, stakeholders, and communities have reduced maternal and child mortality by half since 2000 in most countries, maternal conditions, neonatal and child diseases are still the leading cause of preventable deaths. It accounts for almost 400,000 fatalities annually in East Africa, according to WHO reports. These include, among others, postpartum complications, hemorrhage, birth asphyxia, diarrhea, neonatal sepsis, and related illnesses. In addition, adolescent girls and young women aged between 15 and 24 years, disempowered by disease and structural conditions such as poverty, lower literacy levels, and inadequate availability and access to services account for 30% of all new HIV infections. The region thus has no choice but to take RAMCA services seriously through deliberate investment in these services. Ladies and gentlemen, on 23rd of June 2016, East Africa Community Ministers of Health held a high-level meeting preceding the UN General Assembly and committed to develop, finance, cost-effective universal health coverage. Upon the successful rollout of national and regional UHC financing strategies, the joint East Africa heads of states agreed to prioritize 9 areas, including increased access to safe, efficacious, and affordable medicines, vaccines, and other health technologies for high disease burden areas, one of which is RAMCA. This past December 2021, the EAC Sectoral Council of Ministers responsible for health adopted the EAC Comprehensive Reproductive Health HIV/TB Program 2022-2027, which will guide the region and county investments in reproductive, maternal, neonatal, child, and adolescent health. The strategic plan provides a package of services across the continuum of care of women, including pre-pregnancy, pregnancy, childbirth, postnatal for mother and babies. It also includes child health and development, adolescent health, and its development. There is therefore ample strategic and investment guidance for all stakeholders wishing to invest in this area, and much more remains to be done despite our joint achievements. I wish to echo what our able speakers ahead of me have stated, that this is a journey we need to work together through deliberate transformative partnerships that build on our individual virtuosity on matters health investment, both in public and private sector. Allow me to shift gear and share insights of our region's penetrance and availability of reproductive health services and the challenges our people face today in access, quality, and finance of healthcare. Ladies and gentlemen, nearly all our health facilities offer outpatient services for sick newborns, including low birth weight, close to 9 out of 10. When you come to family planning, 8 out of 10 facilities offer them. When you come to ANC services, 7 out of 10, and postnatal services, similar. 5 in 10 facilities offer delivery services. Looking deeper into the service packages offered to our people, 3 in 10 provide complete set of comprehensive emergency obstetrics and neonatal care. Finally, 1 in 10 offer the complete suite of life-saving basic emergency obstetric care. If you follow the statistics with me, as numbers dwindle through the continuum of care, our women get more exposed to adverse outcome. And it's not a wonder that the region contributes to a large share of maternal and neonatal deaths and morbidity globally. I have given you these statistics so that it acts as a call to action for all of us in this forum today to genuinely plug into this discussion and agenda to make universal health coverage a reality through tangible investments, collaborations to eliminate these glaring health disparities. The foundation and spirit of UHC is ensuring everyone has an equal opportunity of accessing quality healthcare without financial burden or catastrophic out-of-pocket expenditure. In this spirit, it implores us to work together and synergize our strengths and competencies for a better and responsive health service delivery system. As an example, with all the business minds coalesced here today, it is still baffling that we are short of innovative ways of ensuring that a significant proportion of girls do not interrupt their education due to lack of menstrual hygiene product, as it is happening today in the region. We are familiar with the decades-old conceptual framework explaining the barriers of women face to access healthcare. Ladies and gentlemen, these barriers should be viewed as investment opportunities and focal thematic areas of progressive partnership to enable the region realize universal health coverage. I rephrase as an African proverb that if you want to walk fast, you walk alone. But if you want to walk far, we walk together. The desperation of laying the foundation to urgently tame runaway adverse health outcomes in our population led our governments to run alone. But the time has come for us to walk far, and we must walk that walk together through this vehicle of universal health coverage. As an example, the government has initiated free maternity services under Linda Mama to eliminate financial barriers to skilled maternal health services. Beyond Zero initiative by Her Excellency, the First Lady of the Republic of Kenya, has ensured no mother is left behind or denied a decent maternal health service by a skilled provider. Suffice to appreciate the partnership of the government with the private sector, our bilateral donors, the NGO fraternity, faith-based organization in implementing these two novel programs. We further commend the civil society for keeping us on our toes to ensure we do not drop the ball until every woman, every child is safe and healthy. I can only urge us to amplify this and similar partnership that will ensure we can only win as a region. I am aware some of us have developed investment cases and costed implementation plans for reproductive health services. I urge those yet to do so to move with speed, for we usually say what is not costed is nothing short of a wish list. These costed business cases and plans are further made urgent as the region transitions to funding essential health services such as RAMCA from in-country resources. These bold but necessary initiatives require your partnerships to sustain and eliminate the barriers that we have highlighted that our women and girls face in accessing quality healthcare services. I hope I have clarified and laid a strong foundation for urgent and deliberate expansion of the role the private sector has to play in advancing women's health, especially in reproductive services. The private sector is a critical, indispensable partner in provision of healthcare in our region. Indeed, by the end of last financial year, this sector contributed close to 50% of the running health the health services that is provided in our country. Private sector investments in service delivery, innovations, technologies, logistical platforms for RMNH commodities, COVID-19 surveillance, and vaccination drives, including technologies that are needed for surgical support, for heat-stable innovations. Examples like a LAVI balloon tamponade that we have as an innovation, anti-shock garment for managing emergency bleeding after childbirth. These are all examples of innovation that private sector has contributed to. That said, opportunities still are abound for the private sector and the corporate world to fully come on the table and lend their innovative brain and financial brawn for higher calling of giving back the best sustainable healthcare delivery model to the public. As a government, we guarantee the requisite instruments, mechanisms, and policy options are made available to leverage financing from this sector. We remain purposively supportive of mutually beneficial local and international private sector partnership that strengthen the health system. For example, the managed equipment services that we are conducting in Kenya has operationalized high-end medical equipment in places it will have taken longer for government to install alone. I see us leveraging on capital project infrastructure funds for health in the near future, removing prohibitive taxes and pricing regulations, and as recently seen during the COVID-19 pandemic, providing fiscal and monetary incentives to encourage stabilization of the supply chain, finance, and labor markets. In addition, during the transition phases towards sustainable domestic financing, private sector engagement is in information systems, service delivery in hard-to-reach areas and populations, as well as key populations and those in humanitarian context will be extremely needed. In conclusion, ladies and gentlemen, with the advent of mandatory enrollment and obligatory government spending, the National Health Insurance Scheme is set to become the largest source of health sector financing by 2030 in Kenya. We have a moral obligation to ensure that service packages are prioritized in the National Social Health Insurance platforms, while the growth of such distributive health financing schemes may be viewed as a bane to the private sector. If we are short-sighted, it will be more helpful to the agenda of UHC if we seize this opportunity as a private sector to accelerate investments. There has scarcely been a better time for the private sector to multiply investment in the health sector value chain, human resource strengthening, in supporting public health insurance through marketing, digitization, asset management, claims management, among others. Investing in our women, in girls, and the children promises significant social impact and high future-free cash flows lasting decades. Opportunities for the private sector to contribute to the empowerment of women through Ramka business concepts and investments are enormous. The future belongs to those who dare to dream, and I challenge you, ladies and gentlemen, to dream big enough to touch the future of integrated public-private partnership that is staring at us. Thank you, and may God bless you all. Allow me, after that speech, we will have a 4-minute video shown on the screen. Yeah, please, go ahead.
Human health has a major role to play in economic development. There is a direct link between the health of a population and its productivity, and this relationship has been demonstrated in industrialized countries. One of the key President's Big Four agenda is universal health coverage, which aims at making health services accessible to every Kenyan anywhere.
Our journey towards universal health coverage commenced in 2013. The launch of the free maternity program, Linda Mama, which we have heard testimony about, which today currently benefits over 1 million mothers every year. Thereafter, piloting of the universal health coverage has since progressed through various phases, with today's phase being to ensure that Kenyans have health insurance coverage through a reformed NHIF. All these steps have been deliberate and have also been collaborative between the two levels of government, that is, the national government and the county government. So this is a journey that we must travel together with partners, including our county governments, development partners, the public, and other key stakeholders, including the religious community.
Through the leadership of the Ministry of Health, the health sector, that is the government, private and faith-based organizations, have invested massively in healthcare.
If indeed we are going to become the tourism, the health tourism sector in this region, why do people go elsewhere?
You know how many parastatals we have? We have so many parastatals, Kenyatta is just one of them. When you think about KEMSA and you think about NHIF, you think about KMTC, it's a huge institution. Then you come and think about MTRH, Kenyatta, the KEMRI, another very strategic institution.
Kenya remains a regional leader in universal health coverage.
A lot of our people are spending huge quantities of money that runs in the billions, traveling outside this country so that they can get treatment. The worst thing about it is that by the time our people are traveling, cancer is normally at stage 3 or stage 4, and they are not going there for detection. They are going there for treatment. Therefore, the idea is that we address this matter comprehensively.
Kenya has 4 national referral facilities serving Kenyans and also neighboring countries. Uganda, South Sudan, South Ethiopia, Somalia, Northern Tanzania, and Democratic Republic of Congo. Ministry of Health Kenya welcomes investors in health infrastructure, medical equipment, human resource for health, manufacture of pharmaceutical products and vaccines, investment in transplant and regenerative medicine, health innovation and technology, and research. If you want to invest in Kenya or seek medical services in our centers of excellence, contact us through
Thank you very much. Thank you very much. I think the Ministry of Health, Dr. Zainab, thank you very much for presenting Madam PS's keynote address, as well as the video on investment opportunities. And I think they deserve another round of applause. So we'll go into a slightly different area now, which is meant to be from your program with panel discussion, but we're going to sort of tweak that a little bit. These busy schedules that we have, sometimes we end up with speakers not being able to make the time, and especially if we are sort of a little off time. So I have 2 presenters that we'll have. Professor Anyang' Nyong'o and Mr. Mugo Kibati, unfortunately, will not be able to join us at this particular session. But we will start off with Ms. Flora Mutai. She's the board chair of the Kenya Private Sector Alliance. And Ms. Mutahi, so even as you come forward, this forum really, we are looking at investment opportunity. And as KEPSA, I'm wondering what gains has private sector made in advocating for an enabling business in Kenya? How would you describe the ease of doing business in Kenya? I'm sure that's top of mind for any investor who would want to come here. And there's also, you have been strong advocates for green growth. So how would you describe the adoption of green growth models by Kenyan private businesses? So as you have your few minutes here, kindly perhaps take us through that. Thank you. Yeah.
All right. Ladies and gentlemen, good afternoon. Yeah. All right, like you heard, I'm the board chair of Kenya Private Sector Alliance. We heard it from the visionaries. So they cast the big vision. Then the ministry comes and lays the enabling environment. And we step in as private sector because, as we know it, business does not do, government does not do business. So it is really what KEPSA does is we are the umbrella body and we have all the BMOs, which are business membership organizations under us. So we have a convening power to sort of, I would say, advocate. We advocate for policies, we advocate for better taxes, we advocate for a good business environment. So first of all, just allow me to congratulate the AHBS for it was the 7th symposium. It's not easy to put people together to actually speak like this. And in my other hat, when I was the chairperson of Kenya Association Manufacturers, is when the government came out with this new idea of the Big Four. And of course, it was manufacturing, universal healthcare, and we know the rest, agriculture and housing. And they also never waste. Well, okay, let me also give you the journey. So when we're in manufacturing, we had a lot of roundtables with the government and really tried to say, how are we going to make this happen? And I'm sure you did the same thing in your health. But in comes a pandemic like what we saw. And I would like to just congratulate you because you didn't waste a crisis. And I can see the level of investments and actually the attention that the health sector has been getting. And I can see also that, the local manufacturing has actually been promoted greatly within the health sector. So I believe in that regard, we've actually done quite a good job. So we're aware that access to medicines and quality healthcare remains a challenge to developing countries. And it was illuminated, of course, by the pandemic, that brought about a further surge in maternal, physical, and mental health, especially among women and girls. There were a lot of supply chain interruptions. But what I think was exciting, like I mentioned, is it led to shortages of essential drugs and PPEs. But most importantly is that we have stepped up and realized the importance of buying local and keeping our supply chains as short as we can. And as we move forward as a continent, we should not only be aiming to bounce back from these dungeons of the pandemic, but we should also strategize on how to be self-sufficient and avoid this happening again. So collaboration, of course, between private sector and public stakeholders continues to play a critical role in equipping the local manufacturers to enhance their capacities. And such partnerships, so of course, the Kenya COVID Fund board that enhanced production and distribution of PPE. And this is where we really saw something of the strength of KEPSA. Because we are, like I was saying earlier, we were with government almost hour by hour. What is happening? What have you seen globally, locally? And the fact that we could tap into a sector like yours, and I must say, very well organized sector, we were able to almost real time speak to government. And again, because we speak together, government then tends to listen. So you saw how the fund came together quickly. They were able to collect the money. They were able to immediately almost roll it out with proper protocols. And this is what happens when you have a collaboration between the two. And some of the ways we could, I guess we also need to continue is capacity building our local manufacturers through adequate training and education, which is key to ensuring their local future. Provision of various incentives to promote stakeholder investment in the sector. This will ensure an increase in the sector's contribution to the GDP. I think you read us the contribution to the GDP, providing a stable and predictable industrial policy environment that can be achieved through industrialization and consultations with stakeholders such as yourselves. So we invite you to always challenge government through, organizations like us, because that's what we are there for. We are there to help you advocate to government who will give us a local ear. And then lastly, promotion of local value chains. It is really important that we continue to promote them. So now you asked, your question was, what gains have private sector made in advocating for making sure that the ease of doing business? I think you've seen the numbers climb from, I think came from 136 out of, I think, 180. We went to 96, I think, and we are somewhere in the 80s right now. I don't have my exact figures, but I could tell you Kenya has done really well in the ease of doing business. And I'm sure all of you in the room, that competitiveness, cost of doing business remains high in Kenya, in Africa, and it's something we really need to address. Of course, there's also the infrastructure challenge among Africans, because if you look at intra-Africa trade, it remains below 20%. And we don't see why not. I mean, now with the Africa Continental Free Trade Agreement, we need to continue to enhance. And we are happy with the support that you're giving us to be able to sort of enhance trading among ourselves to actually build this number. And just for the statistics, intra-European trade is at 45%. No, intra-Asian is, I think, at 45. And there's another one, intra-European is at 65, if not better. So we definitely have a long journey to go. And so what we're starting to do now in KEPSA is not only look at cost of doing business, we're now going to look at the competitive index. We've started already benchmarking ourselves against other nations to make sure and actually bring out what is expensive. You've seen how the government right now has gone against, has had a fight against the utilities, and I know that's going to be big for manufacturers. And that's the idea. You've seen the fight on infrastructure, and this is all really trying to make Africa self-sufficient. We've just come from a trip with the president in Dubai, and we were telling them, because I'm not sure what you can sell to them, but we were telling them, one, we have the resources, and I'm glad he was talking about training the nurses, so we can take that there. But we're asking them to look at Kenya as the gateway into Africa. And when you look at the numbers, the 1.2, I think 2.1 billion youth population, when he trains them, they can help the rest of the world. We definitely become very, very attractive. So I believe, okay, we've said we're looking at the competitive index, and we've been strong in advocating for green growth. How do we describe it? I think we've done very well in green growth, albeit around, I think a lot of it has been in the energy spaces, where we are converting from the old to green. But it's a conversation that we continue to have at KEPSA and to Ignite, and we are proud of the steps that we are making. We've already started having conversations around the COP27 now. Not only just 26. So what I would say we do at KEPSA is really have that engagement with private sector, with government, to make sure that Kenya is ready, and Kenya is ready to do business with Africa, which is the next step, and that we are competitive as we do that. So thank you very much.
Thank you. A round of applause for Ms. Flora Mutai. So before she dashes away, because she has also another pressing engagement, I have pressed her into taking just one question, one burning question for KEPSA, the Kenya Private Sector Alliance. And I'm glad the ministry that prepares the enabling environment is right here and wanting to work with the private sector. And indeed, sitting with, I was told when you sit with government, they say, we set the policies and you people do. So any questions for Ms. Mutai? Yes. Do we have a mic somewhere?
Hi, Flora. How have you been? So quick question for you around private sector involvement in the health sector. Are we making any headway on the PPP agenda? And what is KEPSA doing about that? Because I think that's been a bit slow in terms of uptake, both at a national level. In other sectors, yes, it's progressing, but maybe not so much in health. And how that could also translate at the county level. That'll be really useful to know. Thank you.
Thank you. Just that's one question for you.
All right. I'm not too sure what the successes in the health has been, but I do know the PPP has come into light. And in fact, we were with somebody who said, from the time they put in they put in the new DG, the Kirigwa guy, definitely it has moved a lot faster. So I don't know whether health, I mean, I'm not sure what progress has been made in health. I think Amit is a better person to explain that one.
The regulatory change, the PPP Act. As you know, it was very restrictive. So we were finding it difficult to work with, say, KMTC, where if they were going to be the trainer and we have a private hospital and we work in cross, or they are the trainers and they use our private hospital and they pay us fees. That could be a good PPP. That they get something, we get something. But to be honest, we haven't got a successful. When we buy equipment and we place it in the counties so that they have a CT scan, MRI, or theater, that's not a PPP. That was managed equipment service, where the government was purchasing in a modeled way to allow private sector to improve services in a hospital. But if I rent the floor at Kenyatta National Hospital, where's the CEO, on top, and then I pay them a rent, then I treat them, and Nairobi Hospital runs that facility, would that be a PPP? Can you say the top floor is? So we haven't got those examples yet, but I'm hoping we get soon.
I think this is a challenge to you guys. Government is here.
Okay, thank you so much. My name is Dr. Kelly Olwach, the CEO at Kenya Medical Training College. KMTC is the largest trainer in Kenya, East Africa, and Sub-Saharan Africa in human resources for health. Actually, as PPP is something that we really need to work on very fast. One of the issues that we deal with, which is a very urgent matter, is student accommodation. That requires a way in which we can think about how to accord accommodation to more than 72 campuses in 44 counties in this country. So this is a major issue that we need to discuss. I know Treasury is reviewing the policy, but it is one area where we need a lot of discussion around. Thank you so much.
Thank you very much. Thank you for that interaction. Thank you very much, Ms. Mutai, for actually telling us more about what KEPSA is doing. And I like one thing you said, let's look at Kenya as the gateway into Africa, indeed in that area of investment. And KEPSA is really supporting the private sector in that area. Thank you so much. And we'll go to our final speaker. Thank you very much, Ms. Mutai. So we'll go to our final speaker. I know we are pressured because other sessions are starting, but we had structured this in such a way that we went through all the enablers, and now we finally go to the nitty-gritty, those who are actually in the industry. So I invite Mr. Vimal Patel. He's the Managing Director, Cosmos Pharmaceuticals. And Mr. Vimal, as you talk about your area, what gains have we made in advocating for an enabling environment to support local manufacturing of health products and technologies, especially that local manufacturing is in our Big Four agenda? Maybe you can focus a little around that, but let's give Mr. Vimal Patel a warm welcome.
Okay, Jacqueline, thank you very much. And thank you for everybody here for my previous speakers who said something. My name is Vimal Patel. I'm the Managing Director of Cosmos Limited, which is a pharmaceutical manufacturing company which makes NCDs, etc., all locally developed and locally sold. So Jacqueline asked the question, what is the private sector doing to enable the environment where the government can act? It's a very good question. I'm a member of Federation of Kenyan Pharmaceutical Manufacturers. There are about 33 manufacturers, and they're all part of this federation. I'm the incoming chair from June onwards, and we try to engage the government, that is the policy makers, the regulatory authority, because we think that it's a symbiotic relationship. Anything you do is symbiotic. We do not exist by ourselves. We need others around us, like you have. And so we engage them on a regular basis. We have a PPB meeting every quarterly where we listen to their issues, they listen to our issues, and we work out a way forward. Secondly, we talk to the Treasury through the Ministry of Health about what sort of regulations and enabling environment do we need for Kenya to be an India of Africa. And I think very clearly, if you see that I've been in the industry for 30 years, if it was not enabling and if the waters were not good enough for me to swim, I would have died by now. So that's a positive sign that we see. I think, in terms of opportunities is my father always said to me, you need to be a fish that learns how to swim in different conditions. So a salmon, where we see a salmon can swim in salt water as well as fresh water. So we need to be, as a private sector, that entrepreneurial, a daring risk taker. And with that came the help of the ministry and the regulators. And I think I got to give the hand to the regulator and the ministry for acting and helping us get to where we are. Okay? We all say Rome was never built in one day, correct? And so it isn't, but we're on the process. So those are the positive things that I've seen. I've seen my company grow from where we had 30 expatriates to 20 expatriates 30 years ago. And I realized that this is not the way for a Kenyan company to grow. We need people within Kenya. And I believe that we have so many clever Kenyans. And not only Kenya, I will talk about Africa as well. We've got many clever people. The only difference is a lot of these clever people tend to go and work. Yeah, so we have all this potential. So what I started doing is that I said, instead of recruiting these people coming here, why don't we do a different thing? Yeah, people get poached, whatever. That's the reality of life. Get a trainer to come regular to the industry and train them. Send people overseas, let them see what other people's houses are like compared to our house, yeah? So that opens the eyes. So that made a lot of difference. The second thing we did is that, look, we're going to be a local manufacturer. We need to start thinking how we are going to be a good local manufacturer. And there are two aspects to it. One is the GMP. We all talk about GMP. GMP means good manufacturing practice, but how are we going to get our company to go from 0 to 10 to 20 to 30? And I said, with today's world of internet and everybody travels, a lot of you travel to and fro so often. The people in Kenya and the people in Africa are going to look for the same quality of medicines that you get in Europe, etc. So if we are going to be in that kind of environment, we need to start pumping our money towards that goal. Yes, it's an expense, but it's something you do because not only because of business, it's something your personal mission. Why were you in this business? Why are you doing what you're doing? There's got to be a bit more than just money. It has to be something of your passion. You want to contribute something that you're a Vimal Patel or you're a Jacqueline or you're somebody and somebody. Yeah, you want to be something. So I think that's what we started doing. And from a company of 40 people, we've got 500 people working for us. Yeah. We're exporting to 17 countries outside Kenya. And we've upgraded our plants. I know there's some policies that don't help us, but if you don't grow, then you are a dinosaur. You need to adopt. And that's the critical bit. Adaptation by private sector with the help of the policymakers and the regulator. And I think you've got a good mix of things to do something potential. Now, what do I have for other investors? I say, come in, Kenya is an enabling country, and I want competition. Why do I want competition? Because it wakes me up. Complacency comes in very quickly. You need to get away from that. You need to be woken up. And competition makes you think harder and you come out with different ideas. So I think that's my take home for all of you. Yeah, thank you very much.
Thank you very much, Vimal. 1 second before you leave. Thank you for really sharing those nuggets in terms of where you've come from in the last 30 years as a local manufacturer. And those who haven't stepped into Cosmos, you ought to. It's really state of the art. And I think you can even see their products, present day, their products would compete with any product in the international market, even just by packaging. So I'll one burning question for Vimal before he leaves. And then I also have a pleasant surprise. One of our speakers was able to make time to make it. So we'll have one more speaker after this, but any burning question on local manufacturing? Clearly, Vimal, you are crystal clear. So thank you so much. A round of applause for Vimal.
Thank you. Thank you very much.
Thank you, Vimal. And we'll have one final speaker. So thank you very much, Mr. Mugo Kibati, for making it. We had already given you apologies, and people were quite disappointed. As the chairman of Kenya Biovacs, that is the subject on the table at the moment. When COVID started, everyone said, if only we had a vaccine. Then when the vaccines came, we're like, there is no access to vaccines. Where do we fit in? What can we get? Now we are at a totally different platform. We are actually talking about manufacturing vaccines here in Kenya. So we are delighted to have Mr. Mugo Kibati, the chairman of Kenya Biovacs, share a few moments with us here and tell us a little bit about what they're doing. So in brief, please tell us, who is Kenya Biovacs? What type of COVID vaccine will you be manufacturing for the local market, or is it for export? And what phase are we at this very moment? Let's give him a warm welcome.
Good afternoon. Thank you, Dr. Tolo. First, let me say, I don't know if I should apologize, because I actually had apologized. And I'll tell you why, because, and I hope, Amit, you don't mind me sharing the backroom deals and everything. We actually agreed with Amit that I would make a presentation last night to a different group in exchange for coming here this afternoon, since I had committed, and today was looking very tough for me. So I did come here last night. And we agreed that if I was able to make it, I would try my best. And so, because I think this is a very important forum. And first and foremost, to congratulate, AHBS just for the entire session today. And I'm sure you had a great morning, which I would have wished to be part of. And so apologies for being late. And therefore, I'll have to be very brief, because I'm sure you've had from quite a lot of people. So, first and secondly, let me also apologize for not being a medical practitioner. I'm an electrical engineer by training, and I'm in the telecommunications sector. And so in a room such as this, I feel woefully inadequate. Amit and Jacqueline, actually, whom I've known for a long time, but Amit, he makes me, he encourages me. And he's told me that this is a friendly room, and my ignorance and lack of knowledge will not be held against me. But say good afternoon. I've been asked to talk about Kenya Biovacs. Jacqueline set out a number of questions. Those are very easy to answer. I can answer them in about a minute. Kenya Biovacs board was constituted just in mid-December. So we are 2 months old. And therefore, we are only at the very, very early stages at the beginning of setting up this BioVax facility. The idea, the notion, of course, has been a long-standing plan. 2 years ago, and I don't want to repeat what I'm sure every speaker has spoken about COVID. I'm pretty sure about that. And that COVID upended our very existence. The way we live changed. But at the very beginning, especially in Kenya, in March 2020, when COVID hit, panic set, because in the next few weeks and months, we realized what we knew all along, but it was brought to a vivid reality for us by COVID, that we are not self-reliant. We are dependent, unfortunately, on a lot of external actors as a nation and as a region. So in the early days of COVID, we were panicked about where are we going to get PPE equipment? Where are we going to get ICU beds? Where are we going to get vaccines when they eventually are developed? And they were eventually developed. And in all those areas, because we are net importers, we stood at the back of the line. We and many of our African compatriots, many of us from the countries that you come from, stood at the back of the line, wondering whether we will get PPE equipment in time, whether we shall be able to put up enough ICU beds in time, and whether we shall get vaccines in time to save lives. And therefore, the notion of self-reliance was brought to vivid relief. And plans that clearly, and I don't want you to think that the Kenya government just suddenly woke up and decided to put up a vaccine manufacturing facility. These have been in discussion for many years. And I can say that from my previous role, and I know you heard from, is it Ishmael? Vision 2030? There he is. So Ishmael, you know, slightly before you, there was a man called Mugo at Vision 2030, it was my responsibility to create the secretariat that Ishmael, I think, and his team, under Ken Wige, are very ably running under very difficult circumstances, I must say. So within Vision 2030, the issue of self-reliance is imbued in the economic, social, political pillars that he spoke about earlier on, because we have an integrated national transformation plan. And ultimately, it is the reason we take our kids to school and we put up all the kind of infrastructure we're putting up. We try and have a constitution, such as we've dropped the word new. We've been saying the new constitution, but it's now 11.5 years old. So the Constitution 2010 is about self-reliance. And so the plans for local manufacturing, Flo was here earlier talking about manufacturing, is all about self-reliance. So the idea has existed, but it was accelerated because of what happened over the last 2 years. And therefore, the president set up a task force early last year to look at what it would take to set up a vaccine manufacturing facility. That task force was under the Ministry of Health and a number of health actors, principally KEMRI. We know we have a very good research facility in this country, KEMRI. Kenya BioVax Institute was incorporated in September of 2021. The board, as I said, was commissioned by the minister in mid-December. My appointment was as chairman was the end of November by the president. And the board was also appointed at the end of November, but actual commissioning was mid-December. And we have very aggressive, ambitious targets in terms of setting up this manufacturing facility. Initially, just the very basics, just a fill and finish facility. And yesterday, I was listening to a great presentation by Revital, and you've been listening to Cosmos. We have an ecosystem already in existence in which Kenya BioVax should be able to fit in neatly. We are not going to be manufacturing devices. And frankly speaking, initially, we're not going to be doing the actual substance, drug substance. We're just going to be under license, undertaking fill and finish. There is a lot of opportunity for collaboration in getting that to happen. We're looking at the regional market. Of course, as you're well aware, there are many other, quite a number of other African nations that are also looking at setting up facilities, and all are at different stages of progress. You've had, Senegal, our neighbor Rwanda, Ghana, South Africa, Tunisia, Egypt, all are at various stages of developing manufacturing capacity in country. So far, we are in the process of just setting up the structures. I'm sure you've all seen an ad that went out a few weeks ago for a design, build, operate, and maintain consultancy, as well as a GMP consultant to help the board determine whether we have a quality facility coming up, both in country as well as at source of the expertise. We're in various discussions with different potential partners, many of them under confidentiality, and I'm sure, there are people who don't have the kind of constraints I have, like rogue media and rogue actors, but I can't. I can't speak to partnerships until they are consummated and until I'm allowed to talk about them. But suffice to say, we are having several conversations with different vaccine manufacturing, global vaccine manufacturers for manufacturing under license, and they are all from all over the world, I'll have you know. We are also having conversations with different potential experts at manufacturing, the process itself of manufacturing vaccines. But having said that, COVID has been the catalyst to the creation of the Kenya Biovax Institute. But the Kenya Biovax Institute is not, or doesn't exist, for COVID vaccine. COVID vaccine is just one of the things that we shall be doing. In fact, more importantly, a few years ago, and Ishmael, I think you'll agree with me, we can say this, partly because of Vision 2030, Kenya left the ranks of LDCs and became a lower middle income country. We graduated to a lower middle income country. And that is great, but it also has consequences. Several consequences that people sometimes forget, because once you graduate from an LDC to a lower middle income country, you forego a lot of concessions that the global community affords LDCs. One of which is our continued enjoyment of the vaccine program under the Gavi, the Global Alliance on Vaccines and Immunization. And the clock started ticking in 2017. And it's a 10-year clock. So you stop being an LDC, you have 10 years to wean yourself off as a country from the program that literally, we depend on literally our entire children immunization program. All the vaccines you can think of, from BCG to polio, all the vaccines, measles, rubella, all of them. By 2027, we're going to have to be self-reliant and self-dependent. So I think it's important to see this vaccine facility, Kenya Biovax, in the larger strategic context, not just in the more short-term, narrow COVID context. As I say, I don't know that today is the day I should be using those analogies. They say, somebody said you never waste a good crisis, or you never waste a good war. But given what's happening in Europe today, perhaps it's not so funny. But the point being that crises are a good catalyst to drive strategic initiatives that have gotten stuck, that don't have the political will because people don't see the urgency. A crisis brings it to relief. And that's what that's what the pandemic did in terms of our entire vaccine and immunization self-reliance strategy. So really, initially fill and finish, but over the next 5 years, develop a fully fledged manufacturing facility for all types of vaccines, and not just vaccines, but all types of therapeutics as well, on which the same platform can be used to develop self-reliance in this country. So really, that's what the Kenya Biovax Institute Limited is all about. Hopefully, in the next coming months, maybe at our first year anniversary, we shall have a lot more to say about it. But I hope I've said enough that those of you who are more expert than I am, especially investors in this particular area, will be able to come and talk to us about different areas where you think you can be able to support or partner or invest as part of this ecosystem on self-reliance. So thank you all very much. And I hand over back to Jackie.
Thank you very much. And before you leave, don't leave so quickly. You've said very many things, and we appreciate that there are confidentiality clauses and all. But people here will still go with, when are we going to ever see that vaccine? Timeline wise, in a year, in 6 months? Give them something to go with.
I am not, I have resisted politics. I kid you, I kid you not. I think the first time someone suggested I should run for office is nearly 15, 17 years ago.
Yes.
And people have never stopped. And I've always said no.
Yes.
Because I'm not a politician.
Yes.
So I don't give predictions on the basis of emotion or a hunch or a gut feeling. Right?
Yes.
Nor do I go against the dictates of political leaders, especially those who are by appointing authority. So all I can say is that at least a fill and finish before the end of in 2022.
A fill and finish by the end of 2022. That's something. Thank you. Round of applause for that.
And I'm not making any news.
Yes.
Or any pronouncement. That means it could happen in April or it could happen in December, right?
Absolutely.
Yes. So
absolutely.
I'm not making any timeline news. But I'm not making any political pronouncements either, because I think, and I've stated this clearly, that while we have very ambitious timelines for whatever reasons, the most important thing is to have a facility that is durable, that is quality, and that is able to do sustainably what Kenyans and the region would like to see from a Kenya Biovax facility. That will be paramount and supersede any other, override any other objectives people may have.
Thank you. You've answered that perfectly. You still can do the politics. We've answered it politically. But thank you very much for that. So there's only one question. So everyone, I've given them only one question. And I'll give it right behind there to Dr. Ann Kihara. There's a mic coming to you.
Thanks. Thank you very much. I'm really happy that prevention is better than cure. Vaccines is the way to go. But my question is one for you. We have spent a lot of attention on childhood immunizations. Maternal immunizations have been lagging behind. So, Biovax, will you be conducting regular implementation research, not just through KEMRI, because we also have the mainstream universities? That's one. Number two, will you have a registry to actually follow up on the disease patterns in this country? And last, what will be the cost, knowing now we're lower middle income country? I'm really worried. We've been on a free program. Will that continue?
Okay, thank you, Anne. Those are very
tough
substantive and non-political, serious type questions. Sometimes I wish it was a politician who asked the questions. Now, look, first of all, let me contextualize Kenya Biovax. Kenya Biovax is the manufacturing component of the entire ecosystem. We do not intend to reinvent the wheel or to duplicate any efforts being undertaken by people better or entities better placed to undertake that. So when it comes to research, for instance, yes, KEMRI and all the various universities and other research institutions, we shall be relying on them to do the fundamental research. We shall build a developmental type, manufacturing type research capacity within Biovax. In other words, once the expert science community has determined, or has come up with a particular vaccine, we will come in, or the research component of Biovax will come in now to engage in how do we now execute the production of that. We shall invest in research in that area and not in the actual science. because we are a manufacturing facility, but we have to work very closely and collaboratively with all the major research institutions. And in fact, my view is that we shall be in there and they'll be in here. In other words, we shall have KEMRI and the universities in BioVax, and we shall be in the university research centers and at KEMRI, but not duplicating what either of us is doing, because really it's about, for us, it's manufacturing. So with that context in mind, and going back to your questions, prioritization of what vaccines are important in this country. We shall have a voice, of course, but as you can imagine, it's not our mandate, so to speak. So I hear what you're saying about maternal vaccines, and I think actually, adult vaccines in general, I think we need to pay more and more attention to. I mean, we know countries that maybe some of you have lived in where people have, say, the annual flu vaccination, but it's beyond that, really. And obviously this conference being about, being sort of focused on African women's health, vaccines for, maternal-based vaccines are important, but the policymakers have to drive that. We shall just be one of several voices in determining what is a priority, right? Once that has been set, once the scientists and the research community has done its job, then we come in to do the implementation. Her last question? Yes, costs. Frankly speaking, I'm not sure that I understand what the implications of exiting that ecosystem will be, but definitely it will be costly. It will be a lot more costly than it is today. So in 5 years' time, we better be prepared to either incur a cost as taxpayers, or produce our own vaccines, which shall still be costly. But given that Kenya BioVax within the next 5 years is supposed to be a commercially independent entity, hopefully the fact that we shall be a commercially independent entity and that our catchment area is the entire region, Eastern Central African region, then that probably should help defray some, if not all, of the costs of getting out of the Gavi program, and that's the idea. So as you can see, and thank you for that question because it illuminates the multifaceted strategic thinking behind Kenya BioVax. It isn't simply to come up with a Moderna or a Johnson & Johnson vaccine. It is about the strategic imperative we have over the next 5 years to make sure that the program that we have of immunization, children and otherwise, that we have to get out of in the next 5 years, we have a replacement for that and hopefully a better one than what we have today.
Thank you very much. Thank you very much, Mr. Kibati. Thank you, Dr. Kihara, for asking questions actually, which area so well. And I believe your set your strategies and moving forward, vaccines at all levels will be a critical point in your strategy. So as we close, we'll give 2 minutes to Dr. Koch.
But I think there's been a lively engagement, starting all the way from the keynote addresses on the vision, understanding where we want to be, understanding from the ministry, and Dr. Zainab, please do thank the PS for us for really having touched quite deeply in terms of her speech. It was really critical about what points of investment and opportunities are there. And of course, then moving on, we have looked at what the private sector is doing. We have looked at local manufacturing. We have looked at